Hi guys, here's Bruno Hochiger. I'm a thoracic radiologist and we are starting more one imaging research pills. Today we talk about aspergillosis in COVID-19 patients. This is one very interesting paper from Spain that report your experience and prevalence of COVID-19 related aspergillosis. It's one of the biggest prospective studies performed in a tertiary hospital and included patients from ICU and use as parameter the European Organization for Research and Treatment of Cancer and mycosis study group. That's the more strong criteria that we have to diagnosis of aspergillosis. Well, the results are very interesting. They found a prevalence of 3.3%, 8 patients from 239. Mostly of these patients are non-immune compromised patients, but are receiving corticosteroids. Mostly of diagnosis, all of diagnosis to be exactly, are probably diagnosis. There is because the biopsy in these patients is so difficult. And thoracic CT findings are meet the criteria in just one case. Then this showed to us that thoracic CT is not specific in this clinical setting. One thing that's very, very important is that 100% of these patients die. And the authors review around 96 previous reported cases from the literature and found the same thing. The mortality is so high, bigger than 50%, and mostly of these cases are probably COVID-associated aspergillosis because it's very difficult to do biopsy in these patients. Your conclusions is that COVID-19 associated pulmonary aspergillosis is very, very important diagnosis, potentially life-threatening complications, and should be included in the differential diagnosis. But it's important to know that it's an uncommon disease. Less than 1 in each 20 patients will develop this entity. And this is one paper from our group that we show the most common findings in cavitary lesions in COVID-19. Septic emboli is one of the most common, pulmonary infarction, and cyst-related changes in COVID-19 pneumonia, much more than pulmonary invasive aspergillosis. This is a very, very good review, one guideline from Europe. It's a state-of-art review, and for the guys that would like to study more, it's a very, very good paper. And thank you very much. See you next week.